Hello, my name's Jason Creasy, and I'm the Managing Director and Principal Consultant at Maven E&L. We aim to provide expert consultancy in the topic area of extractables and leachables, and I have put together this brief introduction to my company and the services it offers. This slide is a little about me. Why am I talking about this? Well, right at the beginning of my career, I had an interest in the very widest selection of dose forms and formulations. My early career gave me the opportunity to develop skills in analytical chemistry, which I still pull on today, in the analysis of complex mixtures in the widest of techniques. Issues such as nitrosamines are still relevant today, and as they were when I first encountered them when working for a consumer health company looking at impurities in gloves and condoms. Throughout my career, I've been lucky to always have interesting work to do and the opportunity to work in new areas that are undergoing rapid change and development. I have been part of true innovation, and I'm passionate about this topic area. There is still so much to do in this area, and I'm convinced that this area works best when we all pull together and manage the knowledge together to ensure medicines are quickly developed to awaiting patients. This is an overview of the topic areas in which I think Maven E&L can add value. I'm going to speak a little bit more about each one. As you can see, there's a broad range of offerings here, but I think it reflects the many areas that extractables and leachables touches, and I hope in this presentation I can take you through a few of those. Let's start with technical risk assessment. Risk assessment is a key step for me in the extractable and leachable process, and I think too many people run quickly past this and straight into testing. I just wanted to be clear that this is not the same as the safety risk assessment step. This is the step before we do any testing. It's the opportunity to gather all the information we have together and to really focus on what we know and what we don't know. It is what we don't know that generally is the risk area. The gap in knowledge is one of the biggest drivers of risk. The true risk may be low, but until it's proven, the assumption is that the risk is high and needs to be reduced. You will see on this slide I've listed a few of the areas that I think links to the severity and the probability of risk, and of course that knowledge gap that drives knowledge and understanding and potentially reduces the risk. Ensuring the regulatory submissions are properly formatted and well written with the right information is key, and never more so than in this topic area. The information around leachable risk and its associated data is often complex and therefore needs to be properly documented and well presented so it is clear and easy to understand. I have written many sections for regulatory submission for a broad range of product types and for many different regulators. I hope to pass on that experience and expertise so that your regulatory submissions are able to communicate as effectively as possible the data and results which you have collected and the proposals are made for leachable risk control are well received. Of course, before we get to the point of showing those studies to regulators, there's much to be done to make sure that the right studies are done and the true risks are explored. Having the right samples and the right methods of analysis are obviously fundamental to the way that we approach this. So authoring and reviewing protocols is something I can certainly help with. There are many aspects to this, as illustrated on this slide, and I do believe that spending the time to get the right protocol is absolutely key to a successful process. Leachable studies are fundamental, as leachable risk is about patient exposure to substances dosed from the drug product. The studies we design here might be the key information in understanding that exposure. There are many factors to consider in putting together a protocol to ensure that leachable studies, which might be a significant investment of time and resources, are a success. Factors such as pre-storage conditions, orientation, secondary packaging, in addition to the fundamentals of storage time and temperature. Additionally, devices and packaging in use periods, all of these can have an effect. Understanding the batching rules, once again, another thing that might apply to some of the results. Understanding and explaining the correlation between extractables and leachables might be a fundamental requirement, particularly if longer-term controls are required when testing extractables rather than leachables. So, as you will see, all of these need a well-planned and executed study to ensure success. If the studies are well designed, then the next step is great execution. However, great execution does not happen by accident. Maven E&L can help you set up and supervise your chosen CRO, or Maven can recommend a CRO most suitable for you and your project. These studies are challenging, and Maven can help you navigate the potential hurdles you might encounter. Maven can act as a bridge between you and the CRO if you're commissioning the studies. Equally, Maven can be a critical friend to the CRO too. There are several steps in any experimental study, and typical or unexpected results at the trace level are not uncommon. Some of the areas where Maven can help include guiding method development, system suitability development and troubleshooting, and defining and understanding the robustness and the ruggedness of the method. With Maven E&L, you're getting subject matter expertise not just in E&L testing, but in the strategy design and communication of concepts that support it. For example, does your company have a general policy in place which underpins the operating procedures you're seeking to implement? Is there clarity in the expectation for a given study, and does the protocol reflect this? How will the results be used? What tasks in the overall project plan rely on inputs from the E&L activity? Maven E&L can be your thought leader and advocate for E&L, providing input in all areas of policy, procedure, and practice. Maven E&L can act as your project leader, where extractables and leachable testing needs to be fully integrated into the wider project of medicine development. Maven can provide input and expertise throughout the product lifecycle, especially when changes occur affecting extractables and leachables. The materials tested will change at some point. What plans do you have in place to mitigate that risk? Active and well-managed relationships within and across the supply chain are fundamental to the success of control strategies for leachables. They start with active engagement to make quality by design a reality and continue into quality assurance and, if necessary, quality control. They continue in their importance throughout the life cycle of the drug product and makes effective change control possible. Maven E&L can help with all aspects of this and help with your supplier agreements. Have you got one in place? Is there a risk assessment in place for the supply chain? These are two questions that Maven E&L might be able to help you with. If you have any further questions or queries, you can visit us at our website at www.mavenenl.com. Maven E&L thanks you for your time today and hope you found this of use.